Hello, and thank you for joining us while we help you piece together your BSSP benefits during the 2022 Benefits Open Enrollment period. October 1st marks the 40th anniversary of BSSP serving Butte County Schools, the County Office of Education, and the Butte Glen Community College District. We are grateful to have had the opportunity to serve you for the last 40 years. Effective October 1st, 2022, medical plan rates reflect a 6 to 7% rate increase after a $7 rate credit from BSSP. CISC has added an additional added value benefit to the medical plan that is available now. There are no changes to the underlying medical benefits. There are no rate changes for dental this year. Services received through Delta Dental's virtual care benefits through Toothpick and Virtual Consult no longer apply to your plan's frequency limits. There are no other changes to the underlying dental plans. There are no benefit or rate changes for vision this year. If your district participates in BSSP's life insurance program, there are no changes to the rates or benefits with the Hartford. Finally, we are adding a new voluntary pet insurance program with Pets Best. Now let's discuss the new benefits available to our members. Voluntary pet insurance is being offered through Pets Best to all employees and retirees enrolled in a BSSP medical, dental, vision, and/or life insurance plan. Pet insurance helps provide peace of mind by reimbursing you for future veterinary bills. You can use any vet in the United States, including specialty and emergency clinics. There are no waiting periods for coverage with the exception of cruciate ligament issues, which does have a 6-month waiting period. The policies do exclude pre-existing conditions up to an 18-month look-back period. Claims can be filed online via the Pets Best app or the Pets Best website. Pets Best offers a wide range of plans to fit your needs and budget. The most popular coverage is the Best Benefits Plan. This plan offers 3 tiers of coverage: Essential, Plus, and Elite. Under each of these plans, you can choose the annual coverage limit, the annual deductible in increments of $50, and the reimbursement percentage options that range between 70 and 90%, again, based on your budget. Pets Best also offers a routine wellness care option to add to any of the best benefit policies. If you're not sure what level of coverage you may need, you can always purchase the basic accident-only plan. Premiums will be based on the age, breed, and location of your pet and the policy in which you select. Pets Best will be an option displayed in the My Health Benefits portal, and in addition to making the election in your portal, you will also need to visit Pets Best website at www.petsbest.com/BSSPpets or by calling 888-984-8700 and give them the reference code BSSPpets to complete your application for coverage. Maven is a free, on-demand maternity and postpartum support service available now to employees and covered spouses and partners enrolled in a BSSP and CISC medical plan. Maven is available to members from onset of pregnancy up to 1 year postpartum. The Maven program connects the expectant mother with a variety of resources from OBGYNs, midwives, nutritionists, and mental health specialists that can supplement the prenatal care already provided by your doctor. Postpartum support services include lactation counseling and sleep coaching, as well as return to work support. Expectant spouses or partners can also enroll in their own track with content specifically designed for the partner. In addition, CISC is offering a 6-month diaper subscription for members who enroll in the Maven program during their first or second trimester, have an introductory call with a care advocate, have 2 appointments with Maven during their pregnancy, and complete the exit survey when the baby is born. Now let's take some time to discuss the resources you have available 24/7, 365. BSSP has many mental health resources available through your benefit plans. We've put together a brief video that discusses all of the resources available to members on the spectrum of care. Please visit our website at bsspjpa.org to listen to the video. Our focus on well-being includes the Employee Assistance Program through Anthem. Sometimes life throws you a curveball or is just a little more complicated than usual. The EAP can help lend a hand in referring you to services that you need. All employees are eligible for the EAP program regardless of enrollment in a BSSP medical plan. The EAP entitles you and your family members or household members to short-term counseling services as well as access to informational websites at anthemeap.com. Each person is entitled to 6 sessions per incident per year. The EAP program also offers legal and financial counseling sessions. As a reminder, the service is completely confidential. You have access to your benefit information anytime, anywhere via our carrier portals. We encourage you to register your portal with Ameriben, our new claims administrator. Through that portal, you can view claims, update coordination of benefits, and order ID cards. If you are newly enrolled in medical benefits after February of 2022, you will not receive an ID card automatically. You can download a virtual ID card and request one to be mailed to you via the Ameriben portal. Please contact BSSP if you have any trouble registering your account. In addition to the online portals, you do have apps available for all of our benefits, so we encourage you to download those to your smartphone or tablet. Another important resource to have available throughout the year is the Benefits Overview Guide. Everyone will receive a copy of the 2022 version from your employer, which provides you with many great insights to your benefit options. When you have a question, whom do you call? If you have questions regarding when your coverage begins and ends, changes to your coverage, or the cost of your coverage, we ask that you reach out to your employer. If you need information regarding network providers, questions on a claim status or payment, or your year-to-date out-of-pocket maximums, please contact the carrier. If you have problems with the carrier after 1 or 2 phone calls, please contact BSSP. We are happy to help and assist in explaining your plan limits as well as helping resolve any claims issues that arise. You can reach us at 530-879-7438 or also via email at bsspj.org. BSSP distributes monthly and sometimes more frequent emails. We use these to communicate important benefit information throughout the year. If you aren't receiving these emails, please email us at bsspj.org so we can add you to the distribution list. Now let's focus on completing open enrollment and answering the question of who needs to do so. This time of year, many say, I don't want to make changes to my medical, dental, vision, or life insurance elections or to my dependents. Do I need to go into My Health Benefits? The short answer is no, you don't, although we think everyone should take a look at their benefits each year. As a reminder, this is your only opportunity to make changes without a qualifying event. Remember, qualifying events such as marriage, divorce, birth, and death of a family member, or changes in employment provide an opportunity to make change within 31 days of that qualifying event. We recommend that you don't make changes in anticipation of a qualifying event, but wait until that 30-day period associated with them. Also, a divorced spouse is no longer eligible for coverage on the first of the month following the notice of entry of judgment. Please be sure to notify BSSP and your district immediately upon receipt. All active employees must make their elections through the My Health Benefits portal. From BSSP's homepage, click on the 2022 Open Enrollment button. From the Open Enrollment page, click the My Health Benefits button. If you registered for your My Health Benefits account last year, you will use the same username and password you have set up. If you don't remember your username or password, please use the Forgot Username or Forgot Password tools. If you are accessing My Health Benefits for the first time, you'll need to click on Create New Account. The My Health Benefits portal reflects the employer contribution for full-time employees. If you are a part-time employee or a retiree, that information will be provided to you from your employer. And if you are double covered for medical benefits within BSSP, The 25% double covered discount will not display within the My Health Benefits portal, but it will be updated on your October paycheck. There are a number of resources available to you throughout the open enrollment period. You can visit the BSSP website. You may contact the BSSP office. You may schedule a benefits counseling appointment with American Fidelity or the BSSP team. Links and telephone numbers for scheduling these appointments are available at the website, and then click on either link to schedule with the appropriate party. And of course, your district benefits staff is available to assist as well. We also have a number of videos available on demand at our website as well, and think these will answer many of your questions. You must make all elections through the My Health Benefits portal by July 14th at 3 p.m. We encourage you to utilize the Plan Cost Estimator tool to help guide you in selecting your medical plan. On the Input tab, you will input your district and bargaining unit, whether you're an active employee or a retiree, and the amount of your district contribution towards your medical benefits. Then you will input general claims usage. For example, maybe you have 1 preventive visit, 2 visits with a specialist, some diagnostic imaging, and maybe a prescription. There is no need to review your past year's EOBs. This tool is designed to be a general big picture look at your plans and costs associated with each. On the results page, you'll see 3 scenarios displayed. Preventive care, which would be the best case scenario. Your expected use, which is going to be based on what you put in your claims information on the Input tab. And then the maximum out of pocket, which would be the worst case scenario. You will find that your experience will be somewhere in the range of all 3. You are welcome to input multiple scenarios to best estimate your situation. If you are currently enrolled in a flexible spending account for unreimbursed medical or dependent daycare with American Fidelity and wish to continue participating, you must meet with American Fidelity each year to re-enroll. If you are interested in any other insurance plans available, please schedule an appointment with a representative. If you are an employee of Bangor Union, Butte College, Orville Union High School District, Palermo Union, or Paradise Unified, please check with your HR payroll representative about opportunities available within your district. Next, we're going to take a few minutes to go over the added value benefits associated with our medical plans. As we discussed earlier, the MAVEN program is available now and does offer that free 6-month diaper subscription for members who enroll during their 1st or 2nd trimester, have an intro call with a care advocate, have 2 appointments with a MAVEN provider during pregnancy, and complete the exit survey when their baby is born. This is an excellent resource for both expectant mothers as well as their partners. Our health and wellness centers are here to serve both you and your family for preventive, primary, and urgent care needs. Barbara, Sally, David, Ben, and Shannon are available in Chico and Orville to meet a broad range of your urgent, acute, preventive, and disease management medical needs. Each of our providers does have a unique area of focus, but they can all diagnose, treat, dispense, and prescribe or refer for the same broad scope of illnesses, diseases, and conditions. Most services are free, and prescriptions are just $4 or $8. If you are enrolled in an HSA plan, in-office appointments are $25 but do include prescriptions at no additional cost. We do have an on-site lab as well as dispensary. Our providers do have the option to consult with a panel of specialists to provide you the most specialized care without any additional cost at the Health and Wellness Center. We offer convenient and extended hours at both of our locations. We do ask that our members complete an annual health risk assessment to utilize our clinics on an ongoing basis. We are pleased to be able to offer telephone appointments at $0 regardless of plan enrollment through the end of 2022. WellBeats is available to everyone on a BSSP medical plan. All family members age 18 and over are eligible for their own account. The WellBeats benefit is much more than a virtual gym, with on-demand videos and many aspects of personal wellness. Everything is available on demand, 24/7, 365, wherever you have internet access. If you have trouble logging in to WellBeats, please contact BSSP at bsspjpa.org. In honor of BSSP's 40th year, we've created a special 40 years of BSSP 2-week Wellbeats program for members to participate. This program features a variety of classes, from relaxing yoga to celebratory dancing to get your heart rate up. Members who complete the 2-week program by September 30th will be entered into a random drawing for an Amazon gift card. As we discussed earlier, the Anthem EAP program is available to all employees and everyone in their household. Anthem EAP offers the Learn to Live Emotional Wellbeing program. With this program, you'll learn effective ways to manage stress, depression, anxiety, substance use, and sleep issues through the proven principles of cognitive behavioral therapy. Highly interactive, individually tailored applications empower users to address these issues while also supporting the physical and spiritual aspects of whole person health. You will complete a short, personalized assessment for a snapshot of your biggest areas of struggle and then choose the program or programs that best meet your needs. Participants receive information and techniques to help build new, more thoughtful habits. Regular assessments provide a clinical benchmark to measure progress, and coaches are available via phone, email, and text to provide information, resources, and reassurance when you need it most. This is your program designed to help you achieve your goals. To access Learn to Live, please visit www.anthemeap.com, enter company name CISC, and then click on the Emotional and Wellbeing Resource button on the right-hand side of your page. With VITA, you have access to virtual care platforms with one-on-one coaching and support for a full range of lifestyle, chronic, and behavioral conditions. VITA's lifestyle programs are available to all members free of charge, which include exercise, nutrition, weight loss, stress management, and more. VITA's chronic conditions program, including diabetes prevention, hypertension, hyperlipidemia, and asthma and COPD, as well as mental health programs for therapy related to anxiety and depression, are available at no cost on the J, K, L, or M plans and may be subject to deductible on the HSA plans. To sign up for VITA, download the VITA app or visit vita.com/CISC. Telehealth services are available through MD Live and are a great option when you can't access the Health and Wellness Center. Your appointment is conducted via phone or video chat over a secure system. In addition to general medical conditions, MD Live also offers behavioral health treatment with licensed psychiatrists and therapists. To access MD Live services, please visit mdlive.com/CISC. Hinge Health provides digital physical therapy to conquer back and joint pain, recover from injuries, prepare for surgery, or to just stay healthy and pain-free. Once engaged with Hinge Health, your personalized therapy sessions are tracked using wearable devices which link to a tablet. Both are provided to you by the Hinge Health program. For those on an HSA plan, services may be subject to deductible. Members on the J, K, L, and M plans can access this benefit at no cost. To get started, visit hingehealth.com/CISC. Teladoc Medical Experts provides an opportunity for an expert medical opinion at no additional cost. This is a tremendous benefit when you are facing a new diagnosis, have recently been released from the hospital, or have been prescribed a new treatment plan. Simply contact Teladoc online or via phone, and you will be matched with an expert in your field of need. Teladoc will gather your chart notes and diagnostic reports from other providers and review with a panel of experts. They may confirm your diagnosis or treatment plan or provide an alternate diagnosis or treatment plan. Again, this benefit is available at no cost on all medical plans. The Carum Surgery benefit provides a concierge experience for hip and knee replacements, spinal fusion, and discectomies at Scripps Hospital in San Diego. Benefits include paid travel costs for you and a travel companion. There is no cost for non-HSA plans, and it is subject to the unmet deductible on an HSA plan. This Center of Excellence has been so designated by demonstrating the best results, fewest complications, and highest levels of personal care. Through Contigo Health, members with a cancer diagnosis have access to the City of Hope's Oncology Center of Excellence. This benefit is an additional no-cost resource for consultation, treatment, and plan development and concierge services for those on a non-HSA plan. If you are on an HSA plan, services are subject to your deductible. You may have an evaluation either in person or via phone. You will develop a customized treatment plan. You'll have personalized care coordination, as well as access to clinical trials and genetic risk educations. Your team at the City of Hope will follow you for up to 1 year post-evaluation to ensure that you are carrying out your recommended treatment plans, track your progress, and make any adjustments as needed. We have just a few other important reminders on our medical plans. The value-based site of care provision applies to arthroscopy, cataract surgery, colonoscopy, upper GI endoscopy with or without biopsy. If these procedures are performed at an ambulatory surgery center, there is no benefit limitation. Currently, Skyway Surgery Center is the only ambulatory surgery center in Butte County performing the above procedures, with the exception of cataract surgery, for which there are other options. The value-based site of care provisions limits the amount paid for hospital-based, non-ambulatory surgery center facility charges to those listed above. The patient will be responsible for the facility charges in excess of those listed here, and there will be no credit toward the patient's out-of-pocket limits for those excess charges. Exceptions are granted if they are requested prior to the service. If the physician provides clinical justification for using a hospital, if a member lives more than 30 miles from the ambulatory surgery center, if a procedure cannot be scheduled in a medically appropriate, timely manner due to the ASCs not having availability, and of course in an emergency. We cannot stress enough that these exceptions may be granted, but only if they are requested prior to your service. The physician who will be performing the service will be the one to request that exception from AmeriBen. If you have any questions, or if you are at the point of being ready to schedule one of these procedures, please ensure that you let your provider know that you have this provision under your policy and that they need to request that exception if they are not going to be performing your service at an ambulatory surgery center. Other facility restrictions relate to bariatric surgery, overnight routine hip and knee replacements, overnight spinal fusions or laminectomies, as well as organ and tissue transplants. Bariatric surgeries require a Blue Distinction Center designation. Here in Butte County, Enloe Hospital does have that designation. Overnight routine hip and knee replacements do require a Blue Distinction Plus Center to have that designation, which Enloe also does. Recently, we have become aware of folks having their hip and knees replaced at an outpatient surgery center. This facility restriction does not apply to outpatient surgeries. This is strictly having to do with overnight stays. And again, overnight spine laminectomies and fusions do need to be performed at a Blue Distinction Plus center. Currently, there are no facilities in Butte County that qualify as a Blue Distinction Plus center for spinal surgeries. The nearest locations would be Mercy Hospital in Reading or Woodland Memorial in Woodland. There are other locations available throughout the state. Please visit the Anthem website to find care that meets your needs. Unfortunately, double medical coverage does not provide double medical benefit. With double coverage, you have the best of two plans, as if it was your only coverage, but no more. A lower plan will generally not reduce the out-of-pockets of a richer plan, and don't forget that if both spouses are on a composite rated plans, you will receive a 25% premium reduction. Consider adding children to the second plan, as in rare cases of high claims, a benefit reserve provision on the lower plan may reduce the out-of-pocket costs under the richer plan. Medical claims must be submitted to the primary plan first and then to the secondary plan. Employees are always primary on his or her own plan. Children are going to be generally primary on the parent with the earliest birth date in the calendar year. When it comes to prescription coverage, we recommend only submitting prescriptions to the richer of the two benefits. Two dental plans do truly provide a double dental benefit, and two vision plans truly do provide double vision benefit allowances as well as frequencies. With BSSP's life insurance with the Hartford, you may not be covered as an employee and a spouse under voluntary life insurance coverage. Each spouse may only elect optional coverage under themselves. For families with double coverage, we recommend that the spouse with the earliest birth date in the year enroll in the preferred plan for the family. In this representation, we're going to call that plan ABC. The second spouse should enroll in the MEC HSA plan. In this scenario, that spouse would have the preferred plan as his or her secondary. For the children, that with the spouse with the earliest birth date in the year means that the children will have the plan ABC or the plan that the family does truly want to be enrolled in. In this situation, everyone should be submitting prescriptions to plan ABC only, regardless of which is their primary. Now we're going to briefly discuss dental, vision, and life insurance. As we mentioned previously, there are no changes to the underlying dental plans or premiums this year. Most employees have the option to pick from one of these four plans. Plan 1 is a traditional Delta Dental plan that subscribes to only the PPO network. This plan provides cleanings and preventive care services at 100%. Fillings are paid at 80%. Crowns, bridges, and implants are paid at 50%. This does have a calendar year deductible of $50 per person, up to $150 per family. Plans 8, 10, and 12 are an incentive style plan. These plans begin at 70%, and as long as you utilize the policy each year, you receive 10% increases in your incentive until you've reached 100%. As long as you don't have a break in coverage, you will remain at 100% for the lifetime of your coverage. Plan 8 is the same as Plan 10 with the exception of the orthodontia benefit. Plan 10 offers a $2,000 lifetime orthodontia benefit per covered family member. Plan 12 is the same as Plan 10 with an additional $3,000 per year calendar year benefit for both PPO and Premier providers. One important note, if you make a decision to move down to Plan 1 from Plans 8, 10, or 12, and then at a later year decide to move back from Plan 1 to Plans 8, 10, or 12, you will restart at that 70% incentive benefit level. As a reminder, there are no changes to the benefits or rates under our vision plans with VSP. Plan 4 is our base plan that offers exams and lenses every 12 months and frames every 24 months with a $250 frame allowance. Plan 8 is the same as Plan 4, but it does allow frames every 12 months. The plans designated with an X are the same as the base plans, either Plan 4 or Plan 8. However, they do both offer an annual supply of contacts at $50 in addition to the frame allowance under the base Plan 4 or Plan 8. This additional enhancement can be very helpful for those who both wear contacts and glasses. All plans do offer the Kids Care benefit, which allows children under age 17 2 exams within a 12-month period, as well as frames every 12 months, regardless of the plan that you're enrolled in. The Computer Vision Care benefit is also available on all plans. This benefit provides an enhanced exam to detect eye health issues related to excessive computer use. The Computer Vision Care plan also offers a $90 frame allowance for materials specifically related to computer use. Some employers provide $10,000 or $50,000 of group term life and accidental death and dismemberment insurance through BSSP and the Hartford. If so, you have the option to purchase employee spouse, as well as child supplemental life insurance. Employees may purchase supplemental insurance in increments of $10,000, ranging from $10,000 to $300,000. Evidence of insurability is required annually if you're increasing more than $10,000 or more than a total of $100,000. For spouses, you may purchase in increments of $5,000 to up to a maximum of $100,000. In order to purchase spouse life insurance, you must be purchasing a minimum of $10,000 in employee supplemental life insurance. Evidence of insurability is required when the increase is more than $5,000 annually or more than a total of $30,000. Child life is also available in $5,000 flat policy. Minimum 10,000 employee supplemental life insurance must be purchased as well in order to purchase child life insurance. Now we're going to briefly discuss voluntary benefits. In addition to the new voluntary pet insurance plan we discussed earlier, the voluntary ambulance cost reimbursement plan through MASA is available to you. The plan covers your deductible, co-payment, and co-insurance for emergency ground or air transportation anywhere in the U.S. or Canada. That reimbursement also counts as your cost share in your out-of-pocket maximum at Anthem and Kaiser. It is important to note that there is no reimbursement under this plan if you have already met your out-of-pocket maximum. Again, it's only a reimbursement of your out-of-pocket associated with the ambulance service. The cost is $14 per month. All employees and non-Medicare retirees already participating in a BSSP medical, dental, vision, or life insurance benefit are eligible to participate in the MASA plan. American Fidelity offers employees of participating districts comprehensive voluntary benefits to complement your BSSP coverage. American Fidelity offers one-on-one open enrollment and voluntary benefits counseling with an American Fidelity counselor that has been trained in BSSP benefits by the BSSP staff. Your district may be scheduling time for in-person visits at your site, and you also have the option to schedule a telephone or virtual appointment. As we discussed previously, you must meet with American Fidelity to renew your FSA election each year. If you are interested in purchasing additional disability, hospital indemnity, accident only, critical illness, whole life, or cancer insurance, please meet with an American Fidelity representative. For more information and helpful videos, visit our website at bsspjpa.org and click on the Podcasts and Videos button. To wrap up our presentation, we just wanted to remind you about the additional added value benefit with Maven. There are no benefit or rate changes with dental or vision or life insurance with BSSP and the Hartford. Again, that new voluntary pet care insurance with Pets Best is available. As a reminder, you will need to enroll both through the My Health Benefits portal as well as the Pets Best website, which is www.petsbest.com/BSSP-pets, and that will enroll you in the policy that you choose. Finally, open enrollment does close July 14th at 3 p.m. All elections must be made within the My Health Benefits portal by that date. Thank you very much for joining us today. For further information, please contact BSSP at 530-879-7438 or email us at bssp@bsspjpa.org. Take care.